What if the heaviness in your legs, the bloating in your belly, and that deep hip tightness aren't just getting older, but quiet signals your body's been sending for years, and you finally learn how to answer them? Today, I'll show you a tiny daily practice that can help your circulation, pelvic floor, hips, and lower back, even your sleep. No equipment, no gym, just 2 minutes and your attention. If you like practical, kind routines that meet you where you are, tap subscribe so these little boosters find you every week without you hunting for them. Most people glance at this move and call it too gentle. That's exactly why it works. Gentle makes it repeatable. Repeatable makes it powerful. The butterfly, soles of the feet together, knees softly opening, targets a neglected zone: the inner thighs, the groin, and the pelvic bowl. When that zone is stiff, everything below the belt feels heavier. When it opens, your whole lower body breathes again. Here's why you might feel lighter afterward. Your inner thigh muscles, the adductors, are like quiet side roads feeding blood and lymph into the pelvis and legs. Sitting, stress, and years of tight to protect can jam those roads. That's when ankles puff, toes tingle, hips grumble, and legs feel weighed down. The butterfly gently opens the gates so fresh, oxygen-rich blood can move in, and your lymph, the body's tidy-up crew, can move waste out. It's not a miracle, it's mechanics. Many women describe the feeling as a soft depuffing, like the tissues are finally exhaling. Let's talk bladder and nighttime bathroom trips because so few people do. When inner thighs are rigid or underactive, they tug on the fascia and ligaments that influence pelvic alignment. Over time, that can nudge the bladder's position and irritate urgency. Butterfly reawakens the neuromuscular signals around the pelvic floor, reminding the body, here's where support lives. Without clenching or hard squeezing, tone and alignment begin to normalize. The quiet win many notice: fewer middle-of-the-night wake-ups, less where's the bathroom, burring errands, and a calmer, more predictable bladder rhythm. If your lower back has been whispering complaints, start where many back issues begin: the hips. Tight adductors tip the pelvis, the spine pays the price. Butterfly targets stabilizers ordinary hip stretches miss. As the groin softens, the pelvis recenters, and your back sighs in relief. Walking feels smoother, sitting less slumped, and stairs less daunting. Treat the root, not the symptom. Your back will notice. There's a nervous system story here too. Slow, rhythmic pulses paired with long, unforced exhales tell your body you're safe. That's the parasympathetic response. Lower heart rate, softer shoulders, quieter mind. Many women feel a gentle wave rise and pass. A yawn, a sigh, even a surprising, "I feel calmer than I thought I would." That's not imaginary. It's your physiology switching from bracing to releasing. Posture improves from the ground up. Instead of yanking shoulders back, which rarely lasts, you restore the base, pelvis, hips, inner thighs, so the spine stacks with less effort. Your chest lifts without strain, breathing deepens, and you feel taller from inside. Think micro-decompression for the lower spine. More space, less squeeze. Let me give you a brief story. Maria, 62, used to call her legs cement pillars. After sitting at work, she'd stand and feel a throb near her ankles and a tug in her lower back. She tried harder workouts, got sorer, then did nothing because everything felt like too much. We gave her 3 minutes of butterfly a day, 1 minute resting in the pose, 1 minute of tiny pulses, 30 seconds of stillness. Week 2, she noticed fewer night trips to the bathroom. Week 3, she stopped bracing on stair rails. Week 4, she said, "My legs don't feel like they belong to someone older than me." No punishments, no perfection, just a small, kind rhythm. Okay, let's make it practical. Sit on a firm surface. Bring the soles of your feet together. Let your knees fall open without forcing. Hold ankles or shins. Inhale softly. As you exhale, begin small, smooth butterfly pulses. Knees floating up and down like gentle wings. 30 to 50 reps. Move slowly. Let gravity help. Keep your spine long, jaw soft. Prefer lying down? On your back, feet together, knees open. Rest, then add tiny pulses if comfortable. Start with 1 minute. Add 15 to 30 seconds each week. Consistency beats intensity. A few safety notes so you feel confident. If you've had recent pelvic or abdominal surgery, acute hip, groin pain, severe osteoporosis, a history of blood clots, or you feel unstable seated, check with your clinician first. You're aiming for light opening, not sharpness or pinching. If anything bites, shrink the range or rest in the position without pulses. Healing is a whisper, not a shout. Common mistakes? Pushing the knees down, rounding the back, bouncing fast, or holding your breath. Fixes: tiny range, tall spine, smooth rhythm, long exhale. And please, no flexibility comparisons. Tissues change with age and use. Yours will open at their own pace. Want a beginner-friendly routine to test drive this week? Try this 3-minute circulate and calm sequence once per day. 60 seconds, still butterfly, hands on shins, deep breathing. 60 seconds, slow pulses, count to 3 on the way down, 3 on the way up. 30 seconds, stillness again. Notice warmth in hips and legs. Optional 30 seconds, gentle forward lean with a long spine, only as far as easy. If you enjoy structure, here's a simple 14-day ramp. Days 1-4, 2 minutes total, 1 min still, plus 1 min pulses. Days 5 to 8, 3 minutes total. Add the 30-second stillness, plus 30-second optional lean. Days 9 to 14, 4 minutes total. Keep it easy, we're training consistency. Progress cues to look for, so your brain gets a gold star. Ankles feel less puffy late day. Getting up from a chair feels smoother. Fewer wake-ups at night. Less back grumble after sitting. A sense of emotional unclenching in the evening. Celebrate any one of these. Tiny wins are the gateway to bigger ones. How to fit it into real life. Habit stack it. Do butterfly while your kettle boils, during an evening TV ad break, or right after brushing teeth at night. Put a cushion where you can see it. That's your visual reminder. If you miss a day, you didn't fail. You're human. Pick it up tomorrow. Quick mid-video nudge. If this practical, kind approach fits you, hit subscribe so you don't have to remember. New routines will nudge you automatically. Let's layer in breath, the quiet amplifier. Inhale softly through the nose. Exhale slightly longer than you inhale, like fogging a window. That longer exhale is your calm switch. Try 4-count inhale, 6-count exhale during pulses. If counting stresses you, skip the numbers and keep the exhale a touch longer than the inhale. The breath is the music your movement dances to. Variations for different bodies. Tight hips? Place a folded towel under your sit bones to tilt the pelvis forward. Range can be tiny, millimeters count. Sensitive knees? Move heels farther from your body. Hold your shins, not your feet. Back grumpy today? Do the lying down version and just breathe. No pulses needed. Want to touch more activation? Gently press the outer edges of your feet together as you pulse. Think switch on, not strain. 2 quick FAQs I get all the time. Will this make me flexible? It will make you usable. Flexibility that you can live in. Standing, climbing, sleeping without throbbing is the goal, not splits. How long until I feel something? Some feel a shift on day 1. Most notice a change by week 2. The big win is not a single aha. It's steady, kind repetition that adds up. A final mindset reframe. Your lower body isn't failing you. It's protecting you. Tightness is often your body's way of saying, I've been helping you stay safe. When you meet it with respect, small range, steady breath, warm attention, it relaxes its grip and gives power back. That's graceful aging, not fighting your body into shape, but partnering with it. Before we wrap, I'd love to hear your body's quiet signal. Heavy legs, tight hips, restless sleep? Leave a note so I can tailor the next routine to you. Share this with a friend who calls her legs heavy or her hips stuck. 1 kind minute a day can change a week. And if you haven't already, hit subscribe with a smile. You're joining a community that chooses gentleness that works over intensity that doesn't.